Today, we're going to talk about internal examination. So this is routinely performed when assessing the progress of labor. Maayong buntag, ma'am. Ako di ay si Shaira Tan. Ako ang moasikaso nimo karon. Explain the procedure to the patient. Ask her to urinate before the exam. Position patient in the dorsal lithotomy position. Demonstrate asepsis during the whole procedure. Put on examining gloves and apply KY jelly. Extend the index and middle fingers and flex the ring and little fingers. Thumb should be pointing up. Separate the labia with one hand. Insert the index and middle fingers of the examining hand carefully into the vagina. Cervical dilation is determined by estimating the average diameter of the cervical opening by sweeping the examining finger from the margin of the cervical opening on one side to that on the opposite side. The diameter traversed is estimated in centimeters. The degree of cervical effacement is usually expressed in terms of the length of the cervical canal compared with that of an uneffaced cervix. When the length of the cervix is reduced by 1/2, it is a 50% effaced. When the cervix becomes as thin as the adjacent lower uterine segment, it is completely effaced. The position of the cervix is determined by the relationship of the cervical os to the fetal head and is categorized as posterior, mid-position, or anterior. Determine the consistency of the cervix as soft, firm, or intermediate between the two. Determine the state of the membranes, whether intact or ruptured. The presenting part is palpated and differentiation of vertex, face, and breech is accomplished. If the vertex is presenting, the fingers are directed posteriorly and then swept forward over the fetal head toward the symphysis pubis. The linear course of the sagittal suture is delineated. The positions of the two fontanelles are ascertained. The fingers are passed to the most anterior extension of the sagittal suture and the fontanelle is examined and identified. Then with a sweeping motion, the fingers pass along the suture to the other end of the head until the other fontanelle is felt and differentiated. Identify the triangular-shaped posterior fontanelle and the diamond-shaped anterior. Determine the location of the lowermost portion of the fetal head in relation to the ischial spines. Document and explain the findings to the patient and inform her what to expect after the procedure. Ask patient for any questions or clarifications.